I'm Ayasha Thomason,
And I'm Heather Stallings.
and today we're going to talk about how ICP does home health visits.
So Aisha, do you want to talk about some of the benefits of home health companies?
Sure. The benefit of having ICP versus just, some primary care person that they're going to try to get into is that we already do this for a living. This is what our nurse practitioners already do. They just happen to do it in a skilled nursing facility. This is basically the same kind of care that we provide, but in a person's home. And we would still coordinate the care with the therapy team and still communicate with them, on a daily basis as needed.
Is it hard sometimes to get a provider, or is there certain insurances to make it where they would ask like us? Because typically they're using somebody else, and then like I've gotten two. So what do we offer
Well,
for
this
these
is usually
home health services?
when they call us, it's because the patient does not have a PCP that they can see in a timely amount of time.
Okay.
So that's,
And they need orders essentially, right?
Mhm.
To be able to do their services. Okay. So that's one thing that we offer. Like, and then otherwise, is it just to be another option?
the thing is, and the reason why we're needed so bad is because they fall under the PDGM model, which is very similar to our PDPM that we do in nursing facilities, which is also like a case mix, just like you're familiar with. But the PDGM relies heavily on clinical characteristics and clinical outcomes. And you can't get those unless you're being seen by a primary care provider, like either a physician or a nurse practitioner. And so these people who were at home couldn't really qualify for home health care or get therapy services because they had to see a primary care provider within a certain period of time of them being discharged from the hospital to qualify. So they didn't have that piece of it. And that's where we fit in. We're completing that link that's missing for them. They're going to be offering to do therapy and, have nursing staff attend to the patients at home, but they don't have anybody that's guiding those orders.
Okay. Missing
so
that continuum of care.
Yeah.
Yeah.
And, and then we can be that person that kind of holds the records. So if we've got a cardiology visit or, renal visit, we can kind of coordinate that care and kind of oversee everything, I guess. And then if they need therapy, we order it and work with them.
So we essentially become their PCP.
We can, or we can be kind of that interim until they get to the PCP that they want to go to. And some of them, just their own PCPs, they can't even get in for 6 months.
Right. And so they need to be able to get started, so we can come in and take care of that so that they can get started.
Mm-hmm.